So my name's Brady McFarlane. I, as Claire said, work at MARC, and also I'm an old age psychiatrist in the New Forest. Thank you all for coming. It's fantastic to have so many people. Can I particularly welcome Dr. Richard Sharples, who used to work at MARC and retired last year, and we're so glad that you joined us and have got away from the golf course. So I'm going to talk a little bit about what MARC does and what we're doing at the moment. I want to introduce the team, talk a little bit about what we've been doing during COVID. I want to cover a little bit about our aims for the year at the moment. But to be honest, this whole charade is an advert, a glorified advert to get you to refer us some patients. So we'll talk a little bit about how and more importantly, why you should refer people to us. And why people should get involved in dementia research trials. And if I've got time at the end, I'm just going to talk perhaps very briefly about one trial. So MARC, as Claire said, is the Memory Assessment and Research Centre. MARC has been around running for about 30 years and has been involved in most of the major dementia trials in that time. So they were involved with some of the early donepezil trials, the early amyloid targeting drugs and things like that. So we currently get involved with commercial drug company funded trials, and these tend to be these big multinational, multi-center trials. But we also get involved in non-commercial, grant-funded academic studies, of which Jay Amin and Clive Holmes lead. Most of our work is with mild cognitive impairment or with mild AD, particularly looking at disease-modifying drugs, but we've also got trials looking at diagnosis or looking at BPSD, and we've also got trials focused on Lewy body disease and other areas. Everyone hates this picture, but I thought I'd show it anyway. So this is the MARC team. So we're a multidisciplinary team. We've got research nurses, research assistants, people with psychology backgrounds, pharmacists, and various doctors. We're based at Moor Green Hospital in Southampton. The observant among you will have deduced that this is a pre-COVID photo, and the main clue of that is you can tell that everyone's hair is pretty groomed. So life's changed since that photo. These are headlines from this time last year. Meghan is obviously still in the headlines at that time, but we were having the first COVID deaths, and we were, I like the one in the top right, so that says coronavirus, now it's getting serious, and this is from Northern Ireland, and it's getting serious because another local footballer has tested positive. And also, I'm still going through my pasta and loo roll that I stockpiled, but COVID really hit us hard. We shut down like the rest of the country in March last year. Most research in the UK stopped, other than urgent public health stuff like the vaccine trials. So we ended up having a lot of Zoom meetings. We redeployed staff to clinical work or to vaccine studies. And we gradually worked on getting COVID secure so we could restart. And actually, I was really pleased. We put a lot of work in and managed to restart lots of studies. We opened up again in the summer, and we've gradually restarted various trials since then, setting up some new trials. And we've even found time to move departments. So we've only just moved offices, but we're very much now up and running and open for business again. So, you know, we're ready to receive referrals whenever you want to send us patients. So I want to talk a little bit about our aims for the coming year. And this is partly linked with the speakers that are coming up. So we're very interested in linking MARC and the work we do at MARC with clinical work. And you hear about this concept of embedding research into routine clinical practice. And what this really means to us is that we think that everyone with a diagnosis of MCI or dementia should have the chance to participate in research if they want to. And we want to be able to facilitate that. So as part of this, we're trying to improve our profile and trying to improve our links with memory clinics, improve links with education sessions and that sort of thing. And Jay is going to talk a bit later about his new clinics, which will hopefully start soon, hopefully provide a real kind of tangible link between research and clinical work. The bit that we're particularly passionate about at the moment at MARC is trying to support trainees in Wessex, and this is partly why we've hijacked the educational slot this afternoon. So Claire G, our chair today, is the first Wessex clinical fellow at MARC. So she's going to talk about her experiences as a trainee next. I've put up this slide to primarily embarrass Zoe and Sylvie, who two of our registrars, who alongside Claire have really kept MARC running over the last year. This is Sylvie and Zoe doing a podcast at the NIHR I think just before COVID this was, and talking about their experiences about getting involved with research as a trainee. So I hope that MARC will be part of making Wessex an attractive place for OPMH in particular, OPMH trainees to come to. And obviously, by trainees coming here, that means that hopefully we'll then get future consultant colleagues, and ultimately it means that I get less gaps on the on-call rota. So everyone's a winner. Talk a little bit about how to refer to us. So hopefully we want to make it as straightforward as possible. So we don't want you to have to know any details about any of the trials that we're doing, any of the inclusion or exclusion criteria. Although if people do want more details, we're very happy to send it to you. And we'll hopefully distribute our newsletter after this to all the audience, so you've got some details of the trials. But ultimately, we're very happy with just a name of a patient, and we'll do the rest. So that can be done by email. So the email address is going to change, I think, at some point when Southern Health gets rid of all their email addresses. But that's email for now. That's our phone number, which I think is still the same, even though we've moved department. And you could even write us a nice letter if you want to, but you don't have to. You could just send us a name, which is particularly easy for people in Southern Health on Rio. But you know, I'm very happy for people in Dorset or other places if they want to send me patients to speak to me directly if they want to. So we primarily want people with MCI or with mild AD because that's the focus of most of the trials. But Jay is going to be involved with lots of Lewy body studies. We're also we're happy for any referrals, really, for anybody interested in research. And if we have a trial that suits, we'll fit patients in. So it's a very brief little bit about why we think people should participate. You know, obviously there's time commitments and there's risks involved with being with research that we go into great details of that with patients, but it's nice to hear about some of the positive bits. So we're passionate that people can benefit from getting involved with research. You know, it really gives people a sense of hope. It allows people to play a more active role in their care, and gives people access to potential new treatments before they'd be available anywhere else. And one of the main things we find is that people really enjoy the kind of monitoring, the support, the regular contact that we provide, particularly in this day and age where people don't tend to stay in OPMH services and they get discharged after diagnosis. We can provide some of that ongoing support, and people really value that. So I'm not going to dwell on this, but very briefly, just to finish off, I'm just going to mention one trial that we're doing that Clive probably won't talk about. So Professor Holmes will talk about MCI and AD disease modifying trials later, but this is one of the trials we're doing slightly outside that area. So this is for patients with Alzheimer's, but it's for agitation. And so as well as that kind of disease modifying bit at the beginning, there's also trials focused on trying to help people live well with dementia. And one of those things is about challenging behavior. And so this is a trial of a medication called dextromethorphan with quinidine. I'm not really sure how it works. I think it's got some mild NMDA antagonism and some other effects. But this is a trial of an agitation medication. It's for people with an MMSE of 6 to 26. I think we've recruited 3 people to the trial. We'd like a couple more before it closes in a couple of months. And this is for people with significant agitation requiring intervention, requiring treatment associated with Alzheimer's disease. So if anybody's got any patients in that, it's a fine balance between people who can participate in a trial but yet are agitated enough to need treatment. So which is partly why it's been difficult to recruit to, but we'd be very pleased to have patients. It's a medication study. I think that's all I want to say, really. So I'll be happy to have questions at the end.